Good afternoon, everyone. I'd like to call the Emergency Policy Group meeting to order. It's good to see everyone. Would the clerk please call the roll?
Good afternoon, Miller.
Here.
Overman. Overman.
Here.
Merman.
Here.
Cronister.
Donald Lazinski for Sheriff Cronister.
Caster. Caster.
Yes, sir. Should
Ross?
be joining shortly.
Very good. Ross.
Here.
Lott.
Here.
Snively. Snively. And Merrill.
Here.
Thank you. You have a quorum.
Thank you, sir. We're now moving to public comment. Each speaker, we've allotted 20 minutes for public comment. Each speaker will have 2 minutes. We have 4 people that have signed up to speak. The first one is Jennifer Cantor.
Good afternoon, Chairman. My name is Jennifer Cantor. My husband and I have been watching this meeting basically almost since you started. One or the other of us have tried to catch it every week. And you guys have been patiently listening to public commentary for several weeks. And one of the things that I've noticed that I haven't heard is something that I wanted to make sure that you did hear, is that everything that you do, no matter what decision you make, I know that you guys always get feedback from the people who disagree with the choices that you're making. I wanted to make sure that you heard that there are a number of people out here who are following what you're doing, the choices that you're making, and appreciate each and every time that you take thought and deliberation to make your decisions, and to do that in our best interest, and are listening to experts like Dr. Holt to get guidance. I wanted to make sure that you heard that and that you knew that your work is appreciated, and that there are many of us that understand that this is far more than you ever dreamed you'd be pressed to do, given that our emergencies are usually, maybe a week of a hurricane and then you're done. So thank you, and thank you very much to Dr. Holt, who's very level-headed and science-based advice has reassured us greatly. Thank you very much.
Ms. Cantor, thank you very much. It's not often that we get calls from someone thanking us for the work that we do, and that goes a long way, hits you right in your heart. We do appreciate it. Thank you so very much for saying that to us. We really do. We really appreciate it. Thank you. Thank you. Robert Lawson.
Hello. The reason that I'm calling is I live on the Bay Zaharias Golf Course in Forest Hills. The Tampa Sports Authority are intending to use a highly toxic lung irritant and a highly flammable pesticide on the golf course on June the 10th, which just on face value, nothing else added, seems an irresponsible thing to do in the middle of a pandemic and with the civil unrest that's been going on. When you add to that the fact that they have made people in the neighborhood ill in the past, have been fined for inappropriate use in the past, and even the notice that they sent out for this application does not meet the standards of the EPA, since it does not include symptoms of exposure. In the past, when I have followed up, they have not notified first responders about specialized equipment that is necessary to deal with this if there's a problem. First responders have been killed by the product in the past. And I'm just highly concerned about the use of this in particular at this time. I have not been able to get anybody to respond to this in the manner that appears to be responsible.
Okay.
That's pretty much it.
Okay. I could barely hear what he was saying. I think he said something about Babe Harris and pesticides we're putting on the golf course by the Sports Authority.
Yes. Should I repeat what I said a little louder?
No, sir. I think we got it. Hold on. I think we got it. Mr. Brewer, do we have Mr. Lawson's phone number?
Yes, sir, we do.
Can Mr. Merrill or someone get with him and find out what's going on there, so maybe we can find out what the Sports Authority's rationale is for doing that? Can we do that?
Yeah, James, if you can just send it to me, just send it by email, and I'll follow up with Eric Hart at the TSA.
Sure thing, sir. I'll send it over shortly.
Okay.
Thank you, Mr. Merrill.
Yep.
We're gonna miss you, man.
You put me in charge of golf courses now.
Oh boy, I had to get it in there. I'm sorry, I had to get it in. Is it Robert Iller? Is it Iller?
Robin did not call in, sir.
Okay. Jeffrey Puglisi?
Yes, good afternoon, Chairman. Thank you. Again, I agree with that. I would like to repeat the sentiments of the lady first caller. Thank you all very much for your service and all you consider when making your decisions. My name is Jeffrey Puglisi, and my concern is about contact tracing or tracking and how it affects my constitutional rights, the Fourth and Fifth Amendment. And I'd like to get an update today, where we are currently with that. I don't believe it's constitutionally according to the Constitution. Our rights are protected, are to be secure in our property, and illegal search and seizures. I believe that using infrared technology to spy in people's homes does not add to that security that we are all entitled to in our properties. And I believe there are people who died to protect those rights. And I would like to be a voice non-supportive of that technology to be used against the people. It may be drastic to say, but it's sort of like weaponizing the health department against people, where you have, and if you're going to be pulling people out of their homes to go be tested, that's where this is leading. That's where it could lead. In your oaths of the elected officials on this board, you took an oath to defend and support our Constitution, not our safety. I know you don't. I know you've seen people not social distancing and stuff, and I understand it's a concern.
So your 2 minutes are up, sir.
Individual responsibility.
So your 2 minutes are up, sir. Thank you very much. Thank you. Emergency management update, Mr. Dudley.
Good afternoon.
Good afternoon.
All right. Can you see the slides?
Yes, sir.
All right. We continue to support in-home testing operations at remote collection sites, Raymond James, Lee Davis, South Shore, and Plant City. Testing conducted last week as of close of business, May 29th. We had 1,881 collections. Total tests since beginning of the operations, 23,767. Testing conducted this week as of close of business, Wednesday, 1,921. As of close of business on the 29th, we had 2,338 appointments scheduled for the week. Raymond James topped off at 1,000 for that week. Also, as of close of business on the 3rd of June, we had 1,053 appointments scheduled for the remainder of this week. You can continue to call 813-272-5900 or make the 5 at the call center to schedule an appointment to visit either one of our sites. Logistics. We have a total of 9,147 kits on hand to continue supporting those sites. As of 8 a.m. today, we've submitted 2,247 resource requests to the state. We continue to have an increase in distribution of those supplies as they arrive in from the state. And we continue to support donation operations. We haven't had a change in the numbers here for a few weeks now, so we do still collect donations on Tuesdays and Thursdays from 9 a.m. to 3 p.m. at 250 West Shore Plaza. Still looking for those critical PPE items if you do wish to donate. Currently, there are 2 guests checked in at the quarantine site and 17 guests checked in at the isolation site. As continued support, we do have a tropical depression crystal ball that is formed out there near Mexico-Guatemala border, 775 miles southwest of Key West, Florida. At this particular time, it does not pose a threat to Florida. Hillsborough County, along with a few other counties, are currently under flood watch at this time through Saturday afternoon. We can expect locally heavy rains, and we'll monitor flooding and keep an eye on the development as this storm continues to move throughout the week and through the weekend. And we also continue to support long-term care facility testing. This concludes my update. Any questions?
Thank you, Mr. Dudley, and I don't see any questions. Let me thank you for your work you're doing. Not only now are you working concerning the testing, but you're watching a tropical storm that's getting out there in the Gulf, probably watching the Atlantic very well too. So anything we can do to help you out, please let us know, sir.
Thank you, sir.
You're welcome. Dr. Holt, Public Health Update.
Yes.
Good afternoon.
Yes, sir. This is Dr. Doug Holt, the Florida Department of Health, Hillsborough County. Today, my focus will be on the epidemiology data and the key takeaways. I'll make some comments, and then Kevin Wagner will review his reports. There are 5 key measures used to assess COVID-19 in Hillsborough County. 2 of the measures, the 14-day trajectory of cases and the 14-day trajectory of percent positive of the results, are indicators of both the amount of COVID-19 and the level of transmission. The number of cases we report is a direct number of those people that we have known or been tested to be infected and are capable of infecting others. While it might not be the entire numbers, with widespread testing, it does include most. Obviously, we want this measure to be low and decreasing. The trajectory demonstrates or implies the level of transmission. For us, the last 14 days, both the numbers and our trajectories have been high and are increasing. The second one is the positive percent of the positive result, percent of results that return positive. As the number of tests being performed, this positive percentage is expected to decrease. Our percent positive results are increasing, while our tests are flat to decreasing. And looking at our testing, to me, that suggests that the people that are choosing to be tested believe they are at risk or infected. Our next two measures that we watch are the percent occupancy of hospital beds, ICU beds, and ventilator beds, specifically those used by COVID-infected persons. The amount of these beds, even before the COVID, is generally low, but the use of these beds by COVID-infected persons is critical because they typically require more specialized rooms. They stay longer in those rooms, and when they need a ventilator, they need them for a prolonged period of times. We are in good shape for this measure. The occupancy overall is really slightly less than what would be normal before our pre-COVID times. The percent of beds being used by the COVID-infected persons is low. Our overall beds, 3.5% have COVID-positive patients, 10% of our ICU beds, and 3% of our ventilators. The next measure of this is our deaths. Obviously, we want this a downward trend, and we are seeing that. Finally, the number of emergency room visits with COVID-like illnesses is also trending down. What does this all mean? My role continues to be to educate, to help people make informed decisions, both our elected officials and the general public. I work for Governor DeSantis, and reporting to Dr. Rivkes, we work to execute an integrated public health response for COVID-19. COVID-19 is going to be here for some time, so our efforts must be sustained and we continue vigilance. The tough choices that both Governor DeSantis and you as the EPG has made over the last several months has allowed us as a community to be better prepared to get through what will certainly be periods of waves and surges. Our case and investigation and contract tracing, we now have our 9 original full-time epidemiologist teams have been augmented by 20 other health department staff who have been trained and on the job for several months. We have received 3 veteran epidemiologists from the state. 5 more arrived this week, and we expect more to come. Our College of Public Health students have been on the front lines and are engaged. Our long-term care facilities, in the opinion of Secretary Mayhew, we are recognized as a model for the state. Local government, the EPG, through Mike Merrill, the coordinated efforts of the 4 hospital system, the leaders of which I speak with daily, and teams from the county, city, and the Florida Department of Health have engaged all of the long-term care facilities in efforts to protect their residents, to assist them in protecting their residents. We work to reduce the chance of COVID entering, spreading, and we've been using widespread testing of all their staff and residents. 80% have been tested in our county, 10% tested on themselves, and we have 10% that we're working to get scheduled. We have a rapid response to any positives, and facilities are given the option of proactively transferring their patients, if necessary, to the hospital. And we have a dedicated ALF that will care for these residents as they transition back from the hospital to their original long-term care. The general public, I think, is well informed on both how to protect themselves and others. I respect and actually trust our community to use this knowledge and their freedom of choice to do what they believe is best. And I also believe we respect each other's right to be different, to make different choices based on those situations. Every day I see a message on my way home, and it says, be calm, be kind, be safe, and we'll get through this together. I believe that reflects the Hillsborough County community. Brief reminder of what we face with COVID-19. This virus spreads from person to person. The vast majority are infected by respiratory droplets of someone. While you can get it by touching a surface and then your face, this is much less likely to happen. Those that are infected are most infectious very soon after the virus enters their body. And what makes COVID-19 a real threat is that the amount of virus that is shed is almost as similar as whether you are ill or whether you feel bad or not. So you are contagious when you feel well. Essentially, we must assume that everyone who has not had a positive PCR test and clinically recovered could either be infected or have a risk to become infected. Masks do work to reduce the amount of virus that an infected person breathes out. Cloth masks, thicker is better, surgical are better, N95 are the best. Some of these masks will protect cells from getting infected, such as the N95. Distance does matter. 6 feet is better than 3 feet. Outdoors is best. Closed spaces and poor ventilation are the worst. Some of the situations depend on just how likely you're around people that are sick or contagious, and both how long. So certain jobs like healthcare workers, long-term care, even those that work to check out at checkout counters or food, cumulatively are at greater risk. Gatherings and crowds matter a lot. COVID is perfectly designed to thrive when there's a large number of people who gather or are close to each other, especially in small or closed spaces. Especially when you don't know them, but sometimes even if you do. So just on a personal level, my new normal is I get my temperature checked daily at work. I'm wearing a mask going in and out of places that I know I'll be face-to-face with others. I don't wear it at home with my 26-year-old daughter, but I would if I had lived with my 85-year-old parents. I wouldn't wear it at the beach, but I would wear it on the way to the beach. Elevators are a tough choice. Public bathrooms I avoid. I'd shop, eat, even work out if I actually had the time at places where I feel safe and comfortable. You're doing things like checking your temperature. Your employees are wearing masks. The tables are spread out. They limit how many there. And I've seen great examples of all of this as above. And I personally would choose to make the choices of where I do those. With that said, I'd like to ask Mr. Wagner to go through, and then we'll welcome any questions. Mr. Wagner, are you available for your slides?
Yes, it's taking a minute to load up. I apologize. Mr. Chairman, do you see the presentation, sir?
Yes.
Thank you. Again, Kevin Wagner, business analyst for the Healthcare Services Department of Hillsborough County. This is the update for the data report to follow Dr. Holt's epidemiology update. First, regarding testing, as we always try to provide the week amount with the providers and with the Raymond James CRCs and the mobile units, we had 14,842 tests completed between the providers and the Raymond James CRCs and mobile units. A little bit higher than Mr. Dudley's report because I count a different day or an additional day. And again, this number was revised earlier today, which is slightly lower than a presentation that was sent to the EPG possibly today. But for the week of 5/24 to 5/31, it was 14,842 tests completed in the community. The county profile as of yesterday, there was 2,384 cases. 60 of those were non-Florida residents, and the other remaining 2,324 were Hillsborough County residents. Women make up 53% of the positive, while men make up 47%, and that stayed the same since we've been showing this information. Regarding the age breakdown of the 0 to 4 to 85 plus age range, from the workforce standpoint, we are seeing a slightly increase in the 25 to 34 age range of being more positive results, as well as the 35 to 44. As you can see, they are both 389 each, and as our highest amounts in those age categories. But again, the working age make up nearly 73 to 75% of the positive cases. And I define the working age of 15 to 64 of years of age, just as a generalization. This slide is new. Dr. Holt and I have seen a couple presentations or demographics, so we decided to include this. What is outlined is the daily positive cases in Hillsborough County since I've been collecting the data around 322 or 323. That is the historical trend. The items in yellow are the last 14 days from May 21st to June 3rd. And the dotted line is the rolling 14-day average that we see a trajectory increase. The rolling 14-day average as of this point on June 3rd was 48.5 cases per day, which is again is an increase. The other component of the three, besides the new cases, is the test. What we see is the number of test results received by the Florida Department of Health every day. Again, we've changed this a little bit just for ease of viewing, but the solid blue line, that is the USF projected daily need of test results of 2250 a day. And you can see the dotted is the 14-day rolling average of test results, slightly below 1,500, approximately near 1,400 cases a day, again, on a 14-day rolling average. Positivity, again, completing with Dr. Holt, what we see here is the daily positive rates that have been received. The items in green are the last 14 days of individual positivity results based upon test results received and the number of positive cases received. So again, the 14-day average as of May 31st was around 2.7%. On June 3rd, indicated here, it's slightly above 3%. But again, the last 14 days are showing slightly higher positivity results. Regarding the hospital ICU, hospitalizations and total beds, we've added this information. This is a point of time review. On June 3rd, the total, speaking on the top left-hand side, the total beds in the system are 4,378. That is a static number. The number of beds available and are used by patients is what floats. On June 3rd, 25%, a little over 1,100 beds are available in the hospital system in Hillsborough County. Moving to the top right, regarding ICU bed capacity, there are 413 beds of the ICU. And on that day, there was an 18% capacity, or about 75 total beds available in the ICU. Regarding COVID-like, in the bottom left-hand corner, hospitalized COVID cases were 172 using up beds. Of that, 22% were in the ICU, and the vast majority remaining were non-ICU hospitalized at 134. Regarding vent capacity, again, there's 743 in the system, but only literally 3 were being used for COVID-like patients, so less than 1%. The remaining vents were used for other than COVID-like. The death trajectory is decreasing, as Dr. Holt indicated. There's nothing new or different, but it is a good sign that it's going down. The ED, emergency department visits with COVID-like illness in Hillsborough County, this is updated once a week, generally by the Florida Department of Health. And again, this was shown before on May 24th, it's about 172 admissions. Once we receive the update, we will update this accordingly. And regarding population tested as of June 3rd, it's a little over 4.2% have been tested based upon the total test results received in the community comparatively to the Hillsborough County population. And I'll stop there. Thank you.
Okay, thank you. We have some questions. Ross, you recognize.
Thank you, Commissioner. This is for Dr. Holt.
Doctor, if I recall correctly, at our last meeting, you reported there were 250 new cases the week prior to that. I didn't hear you give a number today, but I did hear clearly that you said the number of new cases continues to increase. A couple of questions about that just beg to be asked. And one is our county out of sync with other counties in the region or the state, since we're all kind of following the same reopening plan? Is this the same pattern across the state, or is this, are we an anomaly? And two would be, same lines, have you been able to determine where people are contracting, where they're affected? Is it out in the community, a big question mark? Is it at restaurants? I mean, have we been able to determine some of the reopening factors that may be causing some of this increased number of cases? And then the final question is, not to overload you with questions, but the final question is, I noticed there's a significant increase in the number of new cases while the number of deaths continues to decrease. And what can we make of that? Is there some significance to that? Are these cases more mild than they once were, or do we have is there any conclusion we can draw from that?
Yes, sir. Thank you. As always, good questions. The increase from the week before was 450 cases. Looking very closely or watching the epidemiology, specifically the case investigation, where you ask the person where do they think they have been infected, or more importantly, who they were infected by. And then once you do that, the second part is the contact tracing. So we are the ones that we were able to reach almost 90% of the people that are reported positive. And I would like to note that it's very uncommon, probably less than 10%, that anyone declines to talk to us. And this is a purely voluntary conversation that we have with our cases. 40% of those can name who they feel they were likely infected by. And clearly the majority of this, which is seen nationally and internationally, is families, those that perhaps they work closely with or have certain relationships with. About 30% of the people will have an idea of maybe where they recall being around someone, but they can't really provide a name. And many of this is, again, some informal gatherings, but no one, is able to be more specific for us in that setting. And about 30% basically have no idea who or where they might have gotten infected. We look at for clusters who give us some clues as far as whether there is certain places or certain events or certain situations. And to date, we haven't found any of large significance. We have not plenty, but we have anecdotally people that have been at certain parties together, even a work site, construction site, interestingly enough. But these are anecdotal and do not represent really enough to suggest that that's the predominant source. About 10% of the people will be asymptomatic in our interviews. Most of them were tested because they believed they had been exposed, often in a family situation where sometimes they went with the ill person and got tested along with them. And the other big category for that is our screening being done in long-term care in some of the hospitals and other work sites. A small number are curious. So in summary, no, I cannot suggest that we know where the surge is coming from specifically. There was a period of a few weeks ago that the long-term care, but that was distorted by some large outbreaks that we had at that point in time. And as far as the last question, which I believe is sort of anomalies or this is, it's going to change over time. At this moment, we have a larger amount of an increase in our trajectories than some of our surrounding counties. And certainly on a statewide level, we are we do have an increase. But again, we're not alone. There are some examples across the state that show some similarities, and that's not surprising with this virus. It's going to come appear and disappear, if you will. Maybe not disappear, but will surge and then fade away. That's, I believe I answered your questions, but I'd be happy to be more clear or specific or whatever you would like, sir.
Well, I don't know if you can. I mean, I think what we're all struggling for here is to find out these numbers only mean something if you put them again in context. And if you put them against our region and we're out of proportion, then obviously something isn't working well here that may be working well in a more rural county. I guess what I'm struggling for is maybe science can't answer this, but I'm struggling for, is there a particular part of our reopening plan that maybe is happening too rapidly for our county? Is there, and what I'm hearing from you is we really don't have enough data to pinpoint that now, but that I think is what everybody's looking for. And then the other thing is how many weeks do we look at the increase in cases before we say, okay, we've got to do something different because this is getting worse again. And then against the backdrop of all this is, although the infections seem to be increasing, well, they are increasing, the deaths continue to go down, and I'm not sure what to make of that. So anyhow, just an idea of where I'm sure struggling with some of the same stuff. So thank you, Doctor.
Yes. Yes, so I did not answer that last question about the deaths, and I apologize. Of late, the percentage or of the current cases, we are seeing significantly less infections being found in our elderly. Recall, we have completed a fairly widespread testing of our long-term care facilities, and the results aren't final, but we are certainly seeing some reassuring numbers from most of our facilities. So I think the elderly or the people who know they're at risk, I think are doing exactly what they should do, and those people around them are taking care of them. And I believe that's why we're seeing a reduction in deaths at this time. I hope that helps.
That's very helpful. That's good information to have. Thank you, Doctor.
Ms. Snively, you recognize.
Thank you, Chair. And thank you for your reports, gentlemen. I wanted to just kind of circle back with Dr. Holt's comments with regard to contact tracing, and maybe even if you could discuss a little bit about that and text illness monitoring. I know that I've been contacted by several constituents who have had concerns with their privacy rights and making sure that their information is not voluntarily out there, and asking us as EPG members to not authorize contact tracing or not support contact tracing. However, I know that that probably comes, that authorization to utilize contact tracing is not coming from the EPG necessarily. It's coming from a higher authority. And so if you could talk a little bit about contact tracing in the context of privacy, and also where can I direct constituents who have concerns about contact tracing and the use of contact tracing and their rights to privacy? Could you elaborate a little bit on those two topics, Dr. Holt, please?
Yes, ma'am. And I think believe the last 3 to 4 meetings I've tried to explain, so I haven't done a very good job. We speak with someone who's infected. That's the only way we even know anything, and they volunteer. If they tell us someone that they believe is they may have infected, then we reach out to inform that individual. Currently, I'm advising them to get tested. In the past, we would tell them to call us or notify us if they got sick. We would then also make sure that they understood that for a period of time, there could be infected and therefore could spread it to others, and we voluntarily asked them to quarantine. There's a requirement that we notify or try to reach these individuals on a daily basis, and they can choose to be called, which is their choice, or they can offer an option where they go online into a web-based system, they register, they provide that information. That system is then used to send them a text. We don't send them to text, it does. And it basically asks, are you okay? And are you feeling okay? And are you been compliant? And if they say yes, they feel fine and is, we don't know anything. We never hear anything. If they say no, then that does give us an alert, and they are alerted to contact us for follow-up. About 60% of the people choose that option. 40% prefer us to call them every day. We do not use cell phones or any technology that from the case that would extract the information from their phone, an infected person, retracing their steps, notifying anyone that they've been around through that methodology that is available in the world. Florida does not use that. I'm not sure if any other states do. They may, but not in Florida and not in Hillsborough County. I'll stop there.
And I thank you, Dr. Holt. And just to clarify, it is voluntarily information given to you, and perhaps that could be a little bit confused with a previous presentation that we received with regard to geo-tracking. And there might be some folks out there that are getting the two types of tracing and tracking a little bit confused. And so, but I'll stop with that because I appreciate you continuing to clarify that is voluntary. The information is voluntarily given, and that is a strategy that's used to basically try and trace where the individual may have been infected and who they have come in contact with. The second question I have is with regard to some of the testing sites. I just had a question of what may cause some inconsistency with citizens not getting their test results back in a timely fashion or inconsistently. I had 3 constituents that went to test on the same date in the same location, and one individual got their test results back in 3 days, one got them back in 4 days, and one got them back, or one has not gotten them back, and it's been since May the 20th. And so, what can we potentially attribute to why there's some inconsistency in getting test results back in a timely fashion?
Yes, ma'am. I'll speak to the testing that I'm directly involved to, and then certainly offer if additional information through Mr. Dudley or the others from the public sites. The testing, and it was actually in the headlines, is sometimes the labs get overwhelmed. And it takes a long time. The state did enter into a contract with some of the testing sites publicly that with a vendor, if you will, and a subcontractor that essentially overwhelmed and did not do a good job. And their system of how to access the results was not very good. The tests that we are engaged in often are done through probably Quest is the most common for our mass testing that we do from our facilities and some contracted labs to the state. And a lot of them now, because they're commercial, provide portals and other ways for them to go online. And I have heard some challenges from that. Our testing that we monitor for our long-term care facilities, have been relatively timely. And I say relatively, I've had anywhere from as short as 2 days that came from the program. We work in cooperation with the county and Advent Health to do the collection, and those are run by Quest. And I believe that's the same system used by our county, so that it works for us as we work through our long-term care. I think the problems are a lot worse early on, but those are all that's my experience and my understanding about how this is all done. I'll stop there.
And thank you, and I appreciate that. And so at this point, I mean, I know that they're telling the citizens that are getting tested 3 to 5 days for a turnaround. And what would you recommend that I tell the constituent who's waited 15 days for their results?
Let me jump in on that one, Dr. Holt. So not knowing who the person is, it may be the same person that contacted us and we're working with her individually to resolve it. So maybe offline, if you can share the name, we can. We are working with an individual who fits that same pattern. She probably contacted a number of you. And so we're already on that. We're dealing with it. Dr. Holt wouldn't be aware of that. So
that's okay. I just want to make sure that all of the citizens are getting equal, setting the expectations equally. And this might be an anomaly, or I hope that this is not standard. I'll just put it that way. This
was an anomaly.
Okay.
There were some mistakes made. We acknowledge that to the individual. As Dr. Holt said, though, virtually all the tests come in that range of time, and it depends on the volume and capacity and the ability of the testing labs. And so, that is not in our control, but we'll deal with the other person separately. Yeah.
Thank you. I appreciate you looking into that. So thank you very much. Sure. That's all I had. Thank you, Chair Miller.
You're welcome. Commissioner Merman, you're recognized.
Thank you, Mr. Chair. Doug, I wanted to ask you about the long-term care facilities. Has all the testing been completed of those individuals?
Not yet. We are.
Are they scheduled, and when do you expect to have them completed?
Ma'am, we have completed 79% of the facilities, and 10% of those, in addition to those, 10% had done their own testing, which is an option. We have 2% scheduled, and we are engaged with the remaining 10%. They are offered options, and I would emphasize Hillsborough County has stepped up and has an option that isn't available in most other counties, and that's the partnership that I've referred to, and I think Mr. Earley has talked about, where they have taken the, it's almost like they bring Raymond James to one of the facilities and we'll do it there. The results are coming in. This is a lot of tests. We've probably had I think to date, almost 6,000 staff and 6,000 residents tested. So the results are continuing, to come in. I expect them probably over the remainder of this week into early week. But by this time, a week from now, we should have results back from the almost 90%. And our goal is to have those 10% that haven't been scheduled to be provided the option for them to be tested either by us or help them test through their own resources. I hope that answers the question.
It does. Are you still, maybe some of this increase, are you seeing a great deal of the increase coming from that testing in the long-term care facilities, or what's the breakdown? Is it general population? Is it elderly? What's the increase in the positive cases?
Yes, ma'am. We do. I have been watching long-term care very, very closely, I think, as everyone knows. And as I referenced, about 3 weeks ago, almost 40% of our positives were coming from long-term care. But there were several long-term care facilities that around that time we had mass testing, and they had a significantly high positive percentage of their residents and some staff. Since then, that number has dropped down. It's the latest one for a completed week was below 20%. The age, as I referenced, is also dropping. We're having younger percentage of our population. The test that comes back positive are in the younger population. Consistently, we're also seeing about 10% in our healthcare workers. So the trend does not appear to be in the long-term care and or the healthcare. There's pretty stable or decreasing in case of long-term care. I think these are generally just our, typical of our population, with the exception of fewer of our elderly are being positive. I'll stop there.
And one last question. Thank you very much. I was looking at your chart that was on page 5 of the trend, and it broke it down into 14 days. Our last 14 days has actually almost been the highest of any other of the 14-day segments on the chart. And I'm pretty concerned. We've got these protests that are still going on. And those are like incubators for the virus. And I mean, have you talked with your hospital people and Gene Earley? Have you all discussed, is this, and I think I asked this the last time, where's the trigger? When do we kind of sound the alarm, I guess, back out to the community that the cases are going up and you need to be careful? What do you suggest at this point?
Yes, ma'am. The trigger, I said again, there is no specific trigger. You want to watch and educate all of us, the general public, on the number of cases and the positivity rate. And the slide on number 5 is a little misleading in that it goes back way into, I can barely read it, into March or so, when there wasn't a lot of testing, but we were seeing some significant positivity, which I think you'll see on the slide 7. And so in that case, in that situation, the surge we're seeing now is even with more testing, we are going to see higher numbers. And I think we talked about that last week.
Right.
The hospitals, ultimately the hospitals and their impact is what most, all the final trigger, if you will, the one that requires an action, because you can't let your hospitals get overwhelmed. And so I watch that very closely. I speak with the hospitals every day, twice a week. We have task force calls with them. And again, I think that's the one that, would require definitive action. In between, just as I tried to say, we've got to keep educating people that this are, what we're doing and how we do things will either feed the virus or starve the virus. And I'm betting on our community that we will respond to this challenge.
Okay, I really think we need to get some strong messaging out there, especially with the protests. And the fact that you just said that you're seeing a younger age being, a bigger part of the numbers, that just kind of feeds into what's going on in the community right now. So I'll wait and hear other comments, but I'm hoping that our communications team can really send some kind of message out there, not to alarm people, but again, like you said, to educate, to tell people. Like yesterday, I think yesterday was the highest day that we've ever had. It was almost 100 cases. So today I think it was 95. So I don't know how all the other people feel, but I think we better get some strong messaging back out there and not be complacent about it and hope it goes away. Thank you. Thank you very much for your information.
Commissioner Overman, you recognize.
Thank you, Dr. Holt and Mr. Wagner, for all of your research. It's really helpful to give us a good idea of where we are. Mr. Wagner's presentation clearly indicated that we are seeing new cases on a rolling 14-day period, and that the 14-day average is actually doubled per day, is actually doubled in the last 2 weeks. That's concerning. And so I'd like to have a way of asking for a couple of pieces of information going forward so that we can discern what we're hearing here and our fears, address our fears as our numbers continue to rise. Previously, I have asked the question regarding age ranges, and Kevin, you added a really nice piece to it as the percentage of working people and young people. Given that 32% are between the ages of 25 and 44, which are parents oftentimes, and we still haven't asked the question about the number of children in those households and whether or not they've been tested in our contact tracing. Is it possible that the point in time information you're giving us regarding hospitalizations can be done more in a trend manner, Kevin, to show us how we're doing on the hospitalization, since that's a key factor? And then can we find out in our contact tracing what exposure of those 32% represent possible children and households, especially now that schools and summer camps are opening up? Those are my two main questions, because it's clear the numbers are going up. We just have to decide what we're going to do about it if we have an option. Thank you.
This is Dr. Holt. I will start. And the answer to the first question, which is, can we do the daily occupancy rate and the amount of utilization by the COVID people? It is not downloadable, but we could certainly, with effort, I think got a plan to meet with Mr. Wagner next week, so we can find out how to best sustain this. It's not as easy it's not directly downloadable, but so he has been, and the county has been incredibly supportive in providing me access to him and his skill set. The other question as relates to the contact demographic profile, I would say that should be possible. The system can be queried, so I will work with my epidemiologist and make that request, and of course provide it if it's possible.
Thank you, because it does appear as though our number of cases for younger people, as was referred to earlier, but also in children, do appear to be going up. So we may be capturing those children that actually need to be tested, but I'm not sure since it's not required, and that's why I asked the question. But I do think it's important we recognize over the next 2 or 3 weeks the testing increase now that we've addressed our nursing home, long-term care facilities. The bulge we may have seen earlier may have reflected that effort, which is great, and you've been doing a terrific job of catching them. But as we move forward, and since we only have 10% really more to do, this is going to be representative of what we're seeing in the community. So this positive trend that we've seen, that's pretty significant, needs to be watched very carefully, especially given the events of last weekend. So I thank you both for the work you're giving us. But if you could give us a trend line on the hospitalization availability rate, that would be great. Thank you.
Commissioner Merman, you recognize.
No, I put my hand down.
No, still up.
Sorry.
There you go.
All right.
Okay. Dr. Holt and Mr. Wagner, thank you very much for your presentation. We appreciate it. Mr. Earley.
Good afternoon, Mr. Chair and members of the Emergency Policy Group. I'm Gene Earley with Hillsborough County, Director of Healthcare Services, and this agenda item is in response to Commissioner Merman's request to provide the Emergency Policy Group with an update on COVID-19 and access to behavioral health services in Hillsborough County. In response to that request, I met with the Central Florida Behavioral Health Network, the Crisis Center, and the other behavioral health care providers, and asked if they could develop a presentation for the members of the Emergency Policy Group today. So I'd like to thank Ms. Linda McKenan, President and CEO, Central Florida Behavioral Health Network, and Ms. Clara Reynolds, President and CEO, Crisis Center of Tampa Bay, who have agreed to provide a short presentation on behalf of all of the behavioral health providers in Hillsborough County and how they're dealing with COVID-19. So I think at this point, I will introduce Ms. McKenan and request that she start the presentation, followed by Ms. Clara Reynolds. And James, could you put the presentation up for us?
It's up.
Good afternoon. Thank you all so much for asking us to come on today and for the great work that you are doing in ensuring that our county stays safe. For those of you who don't know a lot about Central Florida Behavioral Health Network, we're a managing entity under the contract with the Department of Children and Families to really assure that the safety net of mental health and substance abuse services meets the needs of our communities. Our mission is to provide quality behavioral health system of care that brings help, hope, and hope to the individuals and families and communities we serve. And so in that, we very quickly brought together the providers in our network, as well as the other hospitals in the system in Hillsborough County, to communicate their needs, to assure that we had services in place, and to assure that our providers had the protective equipment and things necessary to assure that services were readily available. In Hillsborough County, just for your information, through Central Florida, we fund approximately $47.5 million for mental health and substance abuse treatment and prevention. Last year, we served about 30,360 people, both children and adults, for mental health and substance abuse. Could you please move the slide? Thanks. So we brought our providers together immediately to be able to assure, especially that our Baker Act acute care and detox system services and processes were in place. One of the big issues that everyone was concerned about, of course, is the possibility that a unit would become infected. And we wanted to be sure that if that occurred, we had a plan to address that, and also a plan to mitigate that occurring. What we did, actually under Baycare's leadership, first started a weekly, actually 3 times a week phone call that included all of the providers as well as the hospitals, and we worked through procedures and processes for clearance. So if someone were to show up at the central receiving facility, be screened as potentially having the virus, they knew exactly what to do and where to send the people. 2 of our hospitals, St. Joe's and HCA, both agreed to take on any COVID potentially positive patients to be transferred to their emergency rooms for testing, and then agreed to keep those people on their medical units until such time that they could be either cleared and sent back to CSU or or they were putting them in their own units. So far, this process has worked really, really well. The Crisis Center of Tampa Bay, I think we'll talk a little bit about the transport part of that later in our conversation. Central Florida worked with the state to assure that we could modify our payment processes, begin paying people either 1/12 or much more flexibility in order to pay for telephonic and telehealth services. We did that really immediately, and our providers within less than a week expanded and moved almost all of their services, outpatient, et cetera, to a virtual platform. And we have been working with the state. We continue to receive supplies, PPE, and we do send them or take them to our providers weekly. Our providers have reported to us daily on their census capacity. That gets reported up to the department, as well as their needs for staffing, et cetera. I think one of the most important things that we've done as a community is Central Florida was able to fund a COVID support line through the Crisis Center of Tampa Bay. You'll see that number is 844 My Florida Help. And we've already received, I think, over 1,000 calls on that line. And again, I think Clara will give you more information about that. Could you move the slide, please? I am just so proud of our providers in the network, as well as the other medical providers and hospitals in Hillsborough County. Services literally never stop. And some of the great things that we've seen about this is that we have actually, because of moving telephonic, increased capacity to serve people. The people are getting in, they're getting access quickly to services. And the other byproduct of what's occurred, probably due to the constant communication between the partners, is there's really been improved coordination for discharging folks, and moving them through the system to where they need to be. I thought a great little point here was a quote from Joe Rutherford that said, Grace Point's strategic plan was to increase telehealth services in 3 to 5 years, and they did it in 3 weeks. And we have seen this across our entire network. We're in constant contact with the Department of Health to address testing needs, isolation. We have had some units that have had to be closed for short periods of time. I'm really grateful to the county and Jean, who has worked with to assure that people that had to leave those units had safe housing in a place where they could also receive remote service. We do have a concern right now. Our providers all do have PPE and are in pretty good shape. And as I said, we do get supplies weekly, but there is an increased cost to our providers that are having to purchase things, and they've absorbed those expenses at this point. But we're concerned about those costs and how we will be able to continue that moving forward. Could you move the slide, please? Thank you. Again, I think your providers in this community are amazing. They've developed really innovative ways to support people that can't come or weren't coming to the offices. They have really done some neat things. They're doing groups virtually. They're doing daily contacts, especially with the people that are homeless or were very dependent on going to day treatment and drop-in programs. So they are actually making contact with them either telephonically daily and also when necessary, sending people out to give support. We also have the ability in our facilities for them to do personal visits where people are coming in. In that case, they are following the guidelines to assure that everyone is safe in their facilities. Could you move, please? Thank you. And now I'm going to move this to Clara, who we really wanted to give you a little bit more information on specifically what's coming in through that support line and what the Crisis Center is doing to assist us. Clara?
Thank you so much, Linda, and thank you all for the opportunity to be here. As Linda said, we have, the Crisis Center of Tampa Bay is just representing all of the providers in our community who truly have come together to make sure that no one has to face this alone. And so I want to first talk about that support line. That support line has really come a long way in making sure that we are recording all of the assistance and supports that are needed. You all know that 211 has been available and providing you with reports about phone calls coming in. So this 1,100 calls represents about the last 3 weeks that we have received. And during that time, you can see the top three. This is not a surprise to any of you all. Callers are still calling in with the request for financial assistance, but they're also looking for emotional support and crisis services to help them deal with the anxiety and depression that they are experiencing due to COVID-19, as well as right now, as we speak, the civil unrest that our community is experiencing, and certainly the lost jobs, the layoff, the unemployment, all of those three have combined together to really create a significant impact in our community. I also want to echo what Linda talked about regarding telehealth and telephonic services. And as you can see in this specific slide, we were doing, as a provider organizations across Hillsborough County, 1,100 services were delivered in January 2020. And you can see across Hillsborough County, as well as other communities, that increased to over 54,000 just in the month of April. So again, to Joe Rutherford's point, many of us didn't feel we could do it, and given an opportunity and necessity, we were able to make that happen. And I think even what's more important is that satisfaction has been expressed both by the clients as well as the staff. So in other words, this is a very effective way of doing treatment, and it is meeting with a lot of great results. So next slide, please. So I think what's important is talking about establishing the new normal. And you've heard many of us across the behavioral health community saying we are preparing for the tsunami. Things like social isolation, the economic impact, and the loss of jobs, everything is going to come together, and it's going to result in more and more individuals who have never reached out for help before are going to need behavioral health services in order to be able to move forward in their lives. And very specifically, individuals who had insurance or other ways to pay for it are now going to become indigent and are going to have to utilize our indigent system in order to be able to get the help that they're going to need. In order for us to meet the needs of this tsunami, we have to expand telehealth and telephonic services. And this is going to require a permanent change in the reimbursement structures from third-party funders. Through the governor's executive order, many of us have been able to provide these telehealth services. But those allowances end with the governor's order. And right now, that date is July 7th. So we really wanted to make sure that you were aware that this amazing service that we've been able to provide may come to an end in early July, just as we are going to see such an increased need. And we want to make sure that we're able to keep what works. We've been able to establish protocols to provide safe environments to provide services for individuals to prevent COVID, as well as to continue to provide safe treatment. But that has required a bold commitment. And you all, as the EPG, as the state and federal level, have come together with the funders and all the providers to make this happen. We just have to continue these bold commitments to make sure that, once again, we can meet this tsunami of need that is coming our way. Next slide, please.
So this slide really talks to the providers who have come together here to work on this and to assure that our services are in place. Again, I really want to recognize the wonderful work that they've done, the Department of Children and Families, and of course, Hillsborough County. Without the partnership, and I know that our leadership staff talks to Jean probably daily, working on problems or issues and in partnership solving them. But I just want to make a big shout out and thank you to providers and also to the hospitals who have also very much come to the table. In some cases, shared PPE, testing equipment, supplies with our providers, because at least in the beginning of this, they were not considered essential services that could get the kind of supplies they needed. And it's just a testament to the whole community of how they have come together to make this work. So thank you. We are open to any questions that you might have.
Okay, Mr. Earley, anything further?
I thought we were at the end.
No, sir, Mr. Chairman, this is it. We just wanted to provide the overall kind of a viewpoint on what's going on in Hillsborough County and how COVID-19 is affecting our behavioral health groups and what they're doing to make it a better and a responsive to the needs of the community.
Okay. We have some questions if you don't mind, okay? Commissioner Merman, you recognize.
Thank you, Mr. Chair. Thank you, Jean. Thank you, Linda and Clara, for your information. Very, very helpful. Actually, to help, I think, not just the EPG, but our community know that behavioral health is one of the results of this pandemic, and that you guys are really fighting the fight, and you're getting a lot done with these individuals that need services. So I really thank you all, especially Jean Earley. I know that you work with these individuals every day. And of course, we have been working with them a lot over this past year to get legislative support for more help. And we hope that that will happen soon in the future. But in the meantime, again, thank you. It was very comprehensive, had a lot of good data in there, a lot of good facts, and we'll be able to use it going forward. Thank you.
Thank you, Commissioner Merman.
Commissioner Overman, you recognize.
I'll echo what Commissioner Merman said. You guys are doing a phenomenal job. Obviously, that tsunami is important to address. And the social isolation, economic impacts, and the fact that more individuals will become indigent is a factor of two things. One, where, not able to open up a lot of employment centers, but also the lack of availability of unemployment insurance, given there's a delay. And do you need a letter from the EPG or from the Board of County Commission or from who to address that July 7th deadline? Because without having the unemployment benefit available to so many, and then running out of resources for rents for those that got it for the last 2 months, but we don't have additional assets for another third month or more. What do you believe, and this is really to our group, what is our process for being able to plead for better unemployment benefit processing or resources for reimbursement to those that are providing the telehealth? I mean, does that come from the BOCC or does it come from our group? I'd just like to ask that question of the group. How do we approach that? Because clearly that wave is coming.
Mr. Earley or Mr. Merrill?
I'm going to defer to Mr. Merrill. I think he's the best position to provide that information.
Mr. Merrill?
Yes. Well, I mean, the benefit of it coming from of a message coming from the EPG is that your group represents all of the county in terms of elected officials, which carries a lot of weight. It probably wouldn't hurt, though, for each jurisdiction separately in their bodies, their elected bodies, the city councils and others, to take a similar action. The more that they hear from all of us is certainly helpful. But of course, the other thing that we need to do is get our lobbying team focused as well, so that the message that gets sent actually gets delivered and gets acted on. So I think all three of those strategies together are probably what we need at this point. And I'll work with Brandon Wagner to make all the arrangements.
Thank you very much.
Okay.
Mayor Castor, you recognize. Mayor Castor?
I'm sorry. I too want to commend Linda on the great things that her group is doing at the Central Florida Behavioral Health, and my good friend Clara for the amazing things that the Crisis Center of Tampa Bay, what they do on a daily basis, 24 hours a day, 7 days a week. And this is an issue that has been lacking support in our community in the past, and now, as it has been described, the coming tsunami. I just want everyone to know, Linda and Clara and everyone else, that I stand ready to do whatever we can, whatever it's going to take to get them the funding that they're going to need moving into the future. Thank you, Chair.
You're welcome.
Thank you.
Ladies, thank you very much for your presentation. Mr. Earley, thank you very much. We truly appreciate it. We'll be there with you, okay? Thank you.
Thank you very much.
Ms. Liana Lopez, Communications.
Good afternoon. I'm Liana Lopez, Chief Communications Administrator for Hillsborough County. Thank you, members of the EPG, for allowing me to provide a brief update on the childcare licensing outreach efforts as directed by the Board of County Commissioners and the EPG. And I will also provide a status report on the reopening survey that is part of the larger public engagement effort officially launched on May 27th. Related to the childcare licensing outreach effort, a working group was established to guide the effort that includes the Early Learning Coalition, the Children's Board of Hillsborough County, the University of South Florida, and Hillsborough County Children's Services, Communications and Digital Media, and the County Attorney's Office. The working group reviewed Governor's Order 20-131, as well as the CDC and Department of Health's updated COVID-19 related guidelines for childcare providers. The team has put together safety recommendations based on this information. The working group agreed that the main form of communication would be a letter and a safety recommendations checklist for childcare providers and partners, with communications outreach efforts to commence on June 5th. The letter addresses additional resources available to the providers, and the safety recommendations checklist highlights the main precautions providers should adhere to moving forward. Additionally, the recommendations checklist is being turned into a handout that providers can print for their use as needed. The letter with the companion information will be sent via email by Childcare Licensing to all Hillsborough County childcare providers, as well as to prospective providers that are in the process of becoming licensed. Additionally, all working group partners have agreed to share the information with their respective contacts identified as members of the targeted audience. A newsroom story will be crafted and hosted on hcflgov.net that includes the pertinent information and safety recommendations to address both parent and provider concerns. Additionally, social media will play a role. Posts will be shared via various platforms, including Facebook, Twitter, Nextdoor, and LinkedIn. The newsroom article will be included in the county's weekly Friday 5 newsletter. The safety recommendations checklist will be updated to the county's business and employment help page. And we will host a Facebook Live question and answer session with experts to address questions from parents related to childcare concerns. Now, I'd like to take just a couple of minutes to update you on the reopening survey that is part of the larger public engagement effort being led by Dean Eric Eisenberg in County Communications. As mentioned, the survey officially launched on Wednesday, May 27th. At the end of a full 2-week period, we plan to evaluate the participation level to determine if we will extend participation another week. Survey questions focus on gaining insights from residents, business owners, and employees regarding attitudes about phased reopening, attitudes about employer actions in the workplace, intentions to continue to take personal safety precautions, comfort level with patronizing in-person businesses, and just general knowledge of COVID-19 coronavirus. I will provide a few highlights from our current point in the data collection, but please keep in mind this update does not provide a complete picture, and it is extremely preliminary. As of close of business yesterday, we had over 10,000 participants, over 195,000 responses, and more than 19,000 comments. Based on the preliminary data received to date, 58% of participants self-identified as an employee and 12% as a business owner. 63% of the respondents to date self-identified as married or in a domestic partnership. 52% of the respondents have children living in the home. Of the participants, 42% are very supportive of a phased or gradual reopening, and 23% are somewhat supportive. When asked what concerns you the most as our community starts to reopen, 63% responded people not continuing to practice social distancing. 53% responded people not wearing a mask or face covering when in public, and 52% responded people will stop the practice of self-quarantine when not feeling well. Other high-level data points include that as of close of business yesterday, 72% responded that they will continue to wear a mask or face covering, and as of now, only 52% acknowledge actually returning to a reopened business. The top 3 safety precautions people want to see businesses adopt before they will return: 75% would like businesses to require face covering or face masks for all employees. 73% said hand sanitizing stations, and 72% social distancing markers and requirements. Now, the top 3 safety precautions people would like to see their employers adopt: 63% said hand sanitizing stations, 52% said social distancing markers and requirements, and 52% would like their employer to require face covering or face masks. Again, I do want to caution members of the EPG that this information is preliminary and should not be taken out of context today. Next Wednesday, we will plan to evaluate the data and determine next steps. Once the survey does close, we will begin our full analysis of the data, and the plan is that Dean Eric Eisenberg will return to the BOCC and the EPG to report the overall results and provide any next steps that we will be undertaking. Residents that have not had the opportunity to participate are encouraged to visit hcfl.gov.net/reopenhc to participate in the survey. To participate by text ReopenHC to 73224, or in Spanish, ReopenHC Español to 73224. This concludes my update, and I am available for questions.
Ms. Lopez, thank you very much for that update, and I don't see any questions, so thank you very much.
Thank you.
Ms. Beck, County Attorney update.
Good afternoon, EPG board members.
Hold on, Ms. Beck. Hold on. Commissioner Overman, you recognize.
I'm sorry, Chair, but I just wanted to thank Liana Lopez. That was a lot of data, and behind the scenes, a lot of work. And I can't thank you enough for all that you've done, not only in the childcare area, but this survey is really helpful to us. It gives us attitudes. And the fact that you've already had 10,000 responses is impressive. So good job. Great job. And thank you.
It's definitely a team effort. So I'll pass it on to my team. Thank you.
Right.
Okay, Ms. Beck, you can continue.
Okay. Good afternoon, EPG board members and Chair Miller, Christine Beck, County Attorney. There are 3 items on our update today, and I would like to start by giving a brief summary of Governor DeSantis's order number 20-139, which was issued yesterday, June 3rd, and it is effective at 12:01 a.m. on June 5th. This order makes it clear that Florida is moving into phase 2 of the reopening plan, and it applies to all counties except for Dade, Broward, and Palm Beach County. The order provides that restaurants and bars and other venues licensed to sell alcoholic beverages may now operate at 50% of their indoor capacity. In addition, movie theaters, concert houses, auditoriums, playhouses, bowling alleys, and arcades may also operate at 50% of the building capacity. And pari-mutuel facilities may seek approval to operate from the Department of Business and Professional Regulation. And finally, the order allows tattoo parlors, acupuncture, tanning, and massage businesses to operate beginning tomorrow. The order continues to encourage responsible individual activity, particularly for seniors and those with underlying medical conditions. And before moving into the draft order regarding face coverings, I'll just pause to see if there are any questions regarding the governor's order that was issued yesterday.
Yes, Ms. Beck, I have a question. If I read it right, that order still says that there could be no more than 50 people in a gathering and recommends social distancing within that group if it's 50 people?
Yes. All persons in Florida are encouraged to avoid congregating in groups larger than 50.
Okay. My other question is, did he give local jurisdictions like this county the opportunity to put more stringent guidelines in place in case we see a upward tick in cases like we're seeing in Hillsborough County now?
Yes, I don't believe that has changed. We are allowed to be stricter. Local jurisdictions may be stricter, yes.
Okay, that answered my question. Thank you very much. I don't see any questions on that, ma'am. Go ahead, continue.
Okay, so on the second item.
Commissioner Miller?
Yes.
This Mayor Ross, I did have a question regarding that. I had my hand up, but I don't think it's working.
Oh, no, I didn't see it, but go ahead, sir.
Okay, Ms. Beck, just a little clarification on the groups of 50, because it looks to me when I read it that this is a guidance, not enforceable. I just want to be clear to our constituents. Is there an order that prohibits gatherings of over the 50 or not? It looks like that's guidance. Can you please clarify that so we're all on the same page?
Yes, you are correct, Mayor Ross. The exact language provides that all persons in Florida are encouraged to avoid congregating in groups larger than 50 persons. So it's an encouragement, not a mandate.
Okay, and that might be something for future discussion if our trends continue. That's the reason I wanted some clarification. So thank you.
You're welcome. The next item on the agenda was with regard to the draft order.
Ms. Beck, hold on. Commissioner Merman, you recognize.
Thank you, Mr. Chair. Okay, so Mayor Ross, you asked a really good question, because a lot of these things, if you go back through the orders, there's not, I mean, it's more of a suggestion and a recommendation. And I guess my thing is if he's saying 50, just suggesting it, are we going to enforce that, especially with an uptick in our numbers? And I guess this question would be for the mayor of Tampa or Don Lazinski. How would we, are you guys going to take a position on this, or are you just going to let, because I know in Hyde Park, they're like going crazy. They're not abiding by any rules. But, so I guess I'm just asking for information and guidance from, you and your because, you know, the sheriff and of course, Mayor Castor, you have the biggest law enforcement agencies in our county. So what are we going to do? I mean, we got an uptick in numbers. What are we doing?
Commissioner Merman, before they answer that question, I think you need to get a clarification what Ms. Beck just said. She said, when the question was asked by Mayor Ross, it wasn't a mandate. Am I right, Ms. Beck?
Right.
That's correct.
It was, what was it again? A suggestion or a recommendation?
Encouragement. It's encouraged.
It's encouraged. That's what I mean. It's so loose. What are we going to do? Our numbers are getting high. And I don't know. Maybe I'm the only one in this group, but I'm very concerned about our numbers.
No, I am also. And with the Memorial holidays just passing, followed by the civil unrest we've had, that there was no social distancing, even though some of them had on masks, some of them didn't. Memorial holiday, a lot of people have on masks, and you've seen the uptick in numbers. I can tell you right now, I have a major concern. I really do. But you asked the question of Deputy Chief Lewinsky and Mayor Castor. So I'm going to call on Mayor Castor first to answer, and then Ms. Lewinsky, if you want to. I'm sorry, Deputy Chief Lewinsky, if you want to answer the question next. Mayor.
Thank you, Chair. This is something that is, and I don't want to speak for the Undersheriff Luzinski, but you know, this is something that is very frightening, because the bars, those are the locations where everyone's in close proximity. You have loud music. So,
Mayor,
yes.
Can you get closer to your mic?
Okay. Can you hear me better now?
Yeah.
Mm-hmm. Yes. Okay. I'm sorry. You know, the bar situation is sort of the optimal location for this virus to spread. People are in close proximity. There's loud music. And so this is something that, first of all, I'm very thankful that the governor has delayed the opening of, but I too share everyone's concern about the increase in the number of cases that we're seeing right now. And now we're getting ready to open up bars to 50%. I have to disagree with you, Commissioner Merman, about Hyde Park, because our Lift Up Local program, we met with all of the talked with all of the restaurant owners, and we're very specific about following the guidelines and have our code enforcement and our law enforcement checking on a regular basis. I know sometimes when you see groups of 10 together, you know, it looks as if the rules aren't being followed, but we have been very strict with that. But to your point, Mr. Merman, it takes our personnel, such a large number of our personnel, just to watch over the restaurant group who are complying. They're all complying, but it still takes a great deal of personnel and effort. And now with the bars, they're really to try to enforce would be impossible. And so we're just going to have to keep an eye on those cases and watch day to day as they increase, and ensure that we're getting the needed services into those areas that are surging. That's all.
I know the great efforts. Can I respond to Mayor Castor? Because I know about the great efforts you're doing with the restaurants. I think that's really good. And when I've been there, I've seen it. I should have prefaced it by saying I heard from constituents who were very concerned by the large numbers of people that are congregating. You probably heard from the same.
Oh, yes. We've heard the same thing, but there's, you know, any minute, any time of a day that they're open, we have officers and code enforcement in those areas as well. So, and that's a difficult, it's a difficult task at hand, which I'm sure Donna Luzinski will underscore. You know, it's difficult enough, and clearly law enforcement in Hillsborough County is pretty busy right now. And now we have the hurricane season coming as well. So it would be very difficult to enforce the limitations that have been put forward, but I do want to express my gratitude to the governor for holding out as long as he has before opening up the bars. That's all.
Sheriff Luzinski.
Yeah, I've got to agree with what Mayor Castro has said. It would be a challenge for us to enforce. We still do get some calls, and we try to go out and continue to educate the public. But particularly right now with everything going on, the protests, that's really a manpower drain for us. So as much as we'd like to, it's a huge challenge to enforce those kind of regulations.
Thank you all.
Commissioner Overman, you're recognized.
Thank you, and thank you both for your responses and our concerns. Given the governor's order, however, the recommendation for someone who's concerned about someone not a business owner possibly not staying in the guidelines. So, for example, you've got well in excess of 50% capacity or a bunch of people together, or given that the order suggests that bar areas may be opened with seated service, and it doesn't say only, but seated service, our constituents are told that they're to call the Florida Business and Regulation. They're the enforcer here. Is if EPG puts something into place that makes these rules clear, does that give law enforcement the ability to do something other than educate? Because right now there's limited resources from the state to do any enforcement when we have a repeat violator, which we've seen in several businesses based on the Safer at Home reports that we get each week. And I'll stop there. So I guess that's really for Christine and how law enforcement might respond if we did something on our own just to reinforce what the governor has said.
Yes, Commissioner. I'll just remind everyone that we always have to be consistent with the governor. So it's always going to be an analysis of whatever language we're wanting to add, whether it's consistent. But he has also at the same time said that we can be stricter on venues and locations than his orders. So I think it would probably require specific, a specific idea to be looked at to make sure we're not running afoul of the state orders.
Okay, Ms. Beck, you may proceed.
Thank you, Mr. Chair. The second item on the update relates to at your May 28th meeting, we were asked to draft and distribute an order at the request of Commissioner Overman. We worked with her office and as requested on Monday, we submitted a draft order which addresses the concern raised by Commissioner Overman. The order states that all persons in Hillsborough County are permitted to wear face coverings, protective face coverings in public and in private settings unless prohibited by a state or federal law. Further, the order provides that any person interfering with another person's desire to wear a protective face covering is in violation of the order. Rudy Hidermoto in my office assisted with this process and will also be available for any questions. And with that, Mr. Chair, I will turn this matter back to you for discussion.
Commissioner Overman, you asked for it to be brought forth. Do you have any comments? Commissioner Overman?
Sorry, I couldn't figure out how to get that unmute button to work. I just wanted to bring this forward because we have heard over and over again how important face coverings is. And what I also want to make sure is very clear is that this order does not in any way mandate using face covering. It merely permits the use of masks or face coverings in public and private settings to allow someone to protect themselves. They've chosen this method as a means to protect themselves. And this order would allow them to protect themselves. Given that there's a risk of a difference of opinion about whether they're effective in our society, I think it would be valuable to allow someone to protect themselves by allowing them to wear a mask and have the protections of the law. COVID-19 risk factors are obviously, based on what we heard earlier, a concern of our community, not only from the survey results, which are preliminary, but also based on what Dr. Holt has continued to tell us about the effectiveness of face coverings. And with that, we see also, because people are returning to work in younger ages, an increase in the number of exposure there. It's clear that face coverings is something that's very important. While we're not mandating them, it's important to make sure that employees and those in public are allowed to wear them. We have to protect our residents from this risk factor. And while, like I said, I'm not an attorney, but I suspect that some employers would be required to make reasonable accommodations per the Americans Disability Act. So this would actually just allow it to be in our domain as a public health protection and as an employee's right. And I'll stop and listen to comments of those that have had an opportunity to read through the order if you have questions. Thank you.
Okay. Mayor Ross, you recognize.
Thank you, Chair. And Commissioner Overman and all my colleagues on the EPG, I have great respect for all of you, and I've learned a tremendous amount from each of you as we've spoken over the past few months. And even though sometimes I might initially disagree with you, over time I come with an open mind. But I can't support this, but not just because I think it's a terrible idea, just because of two things. And one is I think this is the wrong venue. I don't think this is the proper role of the EPG. I think this is something that should be done through the normal existing legislative process. People are going to want to wear masks for a very long time. This is not something that's just a 2-week thing or a 3-week thing. And I think the normal legislative process of a county ordinance or a city ordinance, if you so choose, I think that affords 2 readings. It affords a lot of opportunity for public comment. There are a lot of stakeholders that might have some comments on this. There are business owners, there are professional organizations that might have comments, there are labor unions that might have some comments on this. There are lots of people that might want to provide public input, and this EPG exists to make government more nimble to respond to emergencies. We can shortcut some of that so that we can act very quickly to things that are happening very quickly, hurricanes, natural disasters. I don't think that we should allow our powers to deviate from that. And if we overstretch our powers and we use them to circumvent the normal legislative process, I'm concerned that our powers might be diminished in the legislature in the future as a result. So I think we should use our powers very conservatively, very narrowly, and only to address those things that are immediate and have to be dealt with rapidly. That's reason one. And reason two, and that's the primary reason really, but the secondary reason is the way this order is written, it doesn't differentiate between employment settings or anything. It says that you can't interfere, you can't ask somebody not to wear a mask in any public or private setting. So if you have a private club, a business, a home, you have an event at your home, you have anything, according to this order, you can't tell people you can't wear a mask here. And if you do, it's a second-degree misdemeanor to do that. I don't really think that we need to be telling people and are ordering that type of thing in our community. If you have a private event, I think that we can entrust you to make a decision about your private event. And if you don't choose to attend that event, if you feel uncomfortable because you can't wear a mask, then it's your choice not to attend it. And I just think that it's an overreach of what we're doing. I'm not suggesting that maybe at a legislative level that may be something that should be done, but I don't think this is the proper venue. So respectfully, Commissioner.
Mayor Castor, you recognize.
Thank you, Chair. I disagree with Vice Mayor Ross, and I do believe that this is the emergency legislative body right here, and we are talking about a surge in these cases. And I believe what Commissioner Overman has brought forward is a very simple order that can be attached to the emergency order and will expire when it expires And it is a simple step to allow individuals to protect themselves from the spread of this virus. The research has shown that if individuals wear a mask, if the public wore a mask for 2 weeks, we would cut down the spread of this virus by 80%. And I hear what you're saying, Vice Mayor Ross. I mean, I'm certainly a supporter of the Fourth Amendment and an individual's right to choose, but I believe that that should be applied to an individual's right to choose to wear a mask and not to be denied that ability, especially when we're dealing with a life or death situation, which we are here with the COVID-19. So I certainly will support, and I thank you, Commissioner Overman, for bringing it forward. Thank you, sir. That's it.
Mayor Lott, you recognize.
Well, this is obviously an issue that I think we can come from trying to understand each other and our opinions, and I respect everyone's opinions on it. But I agree with Mayor Ross here, is that when I look at the role of the EPG and what we're supposed to focus on and accomplish on, and when we started this emergency order we had right here, it was not to get into employment law or case law and employment law. And I don't think we have done nowhere near the data, and we haven't done enough research in the community to find out what type jobs that you're putting the employee at an unsafe position to be wearing their job, or where they can't perform their job appropriately for that particular business to be successful by wearing a mask. I mean, and that's why I agree. If we're going to consider something like this, this should be a lot of outreach. We should have public hearings. We should, I don't think this is what maybe some of our population, but obviously a lot of our population as well, does not expect us to take this type of stance in getting involved in employment law during this pandemic. So with all due respect, I know the intent is good. I have a lot of respect for Commissioner Oatman. I think she's wonderful. But, from where I come in representing my community, I don't want to have this overstep without a lot more research and data. So I'll be voting against this. Thank you.
Ms. Snively, you recognize.
Thank you, Chair. And I will thank Commissioner Overman for bringing this up. I think it's worthy of having a discussion in our group and worthy of collecting information. I do echo the sentiments of Mayors Ross and Mayor Lott. I don't know that this is the role for the EPG within our purview. The survey information that's being put out is still incomplete. There's employment law in place, human resources policy, OSHA guidelines, Department of Labor law, state and federal legislation, and I just don't think that this is this is part of what we should be doing as an EPG. I do think it's overstepping our role and not necessarily within our purview, but I do appreciate the sentiment and I do appreciate the conversation, but I would not be able to support at this time. Thank you.
Commissioner Overman, you recognize.
Thank you, sir. And I hear the concerns, and the part of the reason it's coming here rather than the more elaborate process of multiple hearings and lots of of surveys and hearings and input is because this is a temporary order in line with our emergency responsibilities to respond to an emergency that it relates to public health emergency. And while I do appreciate the concerns about possible overreach, in this case, I'm not asking people to, violate OSHA rules or any of the other guidelines that are established for employment groups that have the responsibility of addressing face coverings. For example, we heard earlier in our meetings that law enforcement has its rules on face coverings, and this order does address those exceptions. So if in our state or federal guidelines that there are exceptions to wearing a face covering, this order addresses that. The legislative intent of Ordinance 613 that created the EPG is to protect and preserve the public health, safety, and welfare of our citizens, and in both the incorporated and unincorporated areas of Hillsborough County. So that falls within this intent. And it also allows a citizen the right to wear a face covering, assuming they're able to under federal and state law, without persecution, basically. They're able to wear it freely to protect themselves. The threat here is not some unknown thing. The threat here is a virus that Dr. Holt specifically said today is that people will share whether they know they're ill or not. And we're seeing that now with an increase. This would only be during our emergency orders. And so it would allow us to ask everyone to participate in this, and then it would protect an employee in some setting that would allow them to say, I need this. If you have, as an example, if you have an underlying health condition that would compromise your ability to function, but not lose your job. I mean, you could do your job, but you're at health risk of not wearing a mask. And your employer says to you, sorry, I'm not going to tolerate that. And if you insist on doing that, you're at risk of losing your ability to take care of your family and work. And you would actually end up being fired and not be eligible for unemployment. I don't want to condone that kind of outcome. And that's why I brought this forward. It is only as a result to a response to a public health emergency. It is not a permanent order. So I would like for those that are concerned about this overreach, as it's been called, recognizing it is as a consequence of our emergency that we are addressing a public health emergency and protecting those employees that would like to go back to work, but clearly can't if they don't have the protections for themselves. And I'll stop there.
Commissioner Merman, you recognize.
Thank you, Mr. Chair, and all the comments have really been said. Thank you. Commissioner Overman, I appreciate what you're trying to do, and I really looked at this pretty hard. Maybe it's my legislative training, but interfering in that relationship between the employer and employee really starts to tread on thin ice. I think our better message would be to just tell people, we want you to wear a mask, not worry about the employer-employee thing, because I do think it works both ways. The constituent concerns, if 52% of it, people say they want to require face masks, you also almost have an equal amount of people that say, I don't want to wear a face mask, even if my employer wants me to. And so I think it does work both ways. And that's where it gets to be in that confusing line between the employer and employee. I think we've still got to educate people to wear masks. And that is the bottom line. I do think most businesses are being very prudent. And I think they are asking their employees to wear masks. But, to put this, I know you say it's not a requirement, but I just think it's, Mayor Lott put it very correctly. So I'm not going to be able to support this today, especially without a lot of input from the public. Thank you.
Mayor Castro, you recognize.
Thank you. I was going to move to accept Commissioner Overman's addendum to the emergency order, but I think we need to hear from Commissioner Overman. It doesn't sound like there is support, which I really can't imagine, just to allow individuals to protect themselves, whether they're at work or wherever they choose to wear their mask. But I think Commissioner Overman needs to weigh in.
Commissioner Overman?
I'd like to ask quickly, Ms. Beck, to address the comments that have been made so far regarding the employer relationship. Does this order compromise their ability, or as best we can tell, is this written in such a way that it compromises an employee's ability to protect themselves or not?
Let me ask Rudy to try to address that.
Sure.
Thank you.
Good afternoon, EPG board members. Rudy Haderman of the County Attorney's Office. The manner in which this order was drafted is legally defensible for three reasons. One, it's a temporary order. Two, it's within the purview of the EPG with respect to its obligation to preserve the health, safety, and welfare of the public. And three, the constitutional standard that we look at is that is the order rationally related to a legitimate government interest? And in this case, based on all the case law that we've reviewed, as well as some recent cases addressing this issue, we believe that the order as drafted is legally defensible.
Thank you, Rudy. I appreciate that. Like I said, all this order, all it says is if you choose to have a right, if you choose to, you have the right to wear a face covering. It's not a mandate to wear one. No, a no vote will signal to your constituents that you do not value the rights of a resident to protect their health. The employees should not fear being terminated for taking responsible steps to ensure their well-being and those around them. And I hope that you vote your conscience to protect the 1.4 million people in this community with many pre-existing conditions to protect their right to wear a face covering. I mean, I can kind of read the tea leaving here, but I think it's important to hear what Rudy offered us as a way of a context of this order. Thank you, and I'll stop there.
So what's your pleasure, ma'am?
I move approval of the order to face covering order.
A motion by Commissioner Overman. Is there a second?
I'll second, Mayor Castor.
Second by Mayor Castor. Is there any further discussion? Mayor Lott, you recognize.
Thank you. I want you to know that when we try to make a decision, like what we have before us here today, we have data, we have history, we have results, we have surveys, and I appreciate the emotion, and I don't appreciate the actual threat we just received, but I do feel like we are asked to make a decision that we have no data on, we have no results, we have no surveys, we have no cases of how many, if anyone's been fired, or how many people's been fired. There's nothing, so we have no data to base a decision on other than a gut feeling. So, with all due respect, if we're going to bring something forward, I would prefer if we brought something forward with facts and data. And not hearsay and emotions. Thank you so much.
Mayor Ross, you recognize.
Thank you, Mr. Chair. I just wanted for the public edification, this order that I am not in favor of does not say this only protects employees from mean employers. That's not what this says. What this order says for the public that's listening is that nobody in any public setting or any private setting can prohibit somebody from wearing a mask. So if you have a private business or a private club Suppose you have a coin shop or a jewelry shop, or I don't know, fill in the, whatever you own, this is your business. You currently, under state and federal law, you have the right to tell people, I know you're a concealed firearms carrier, but you can't come into my business with a gun. That's my right to choose that.
Right.
Okay. So what this is, now I know that's not quite apples and apples, I understand that, but the point is, what we're telling you is no matter what setting, you can't tell somebody they can't wear a mask into your business. So if somebody decides to come into your coin shop wearing a mask that conceals their whole face, you can't refuse to buzz them in. And there's a lot of unintended things here. That's why laws are crafted so carefully, and that's why there's multiple readings of them and there's public comment. And so I don't want to be painted with the brush. The four of us who are not going to vote in favor of this are mean and we don't care about people. That's not fair. And we do care about people just as much as everybody else, but we also care about your rights. So I just wanted to say that. Thank you.
I think there are provisions within the order that preclude the circumstances of which you were describing, Mr. Ross, Mayor Ross. The state and federal guidelines do have exclusion for certain occupations, certain businesses that prohibit face coverings. I think it's banks, maybe what you were just describing, those businesses that have specific rules against prohibiting face coverings, and those still apply. But Rudy might be able to offer us some guidance there in case that's a specific issue that you're concerned about. Can you help us there?
Yes. This is Rudy Haterman. I think the language that was inserted in paragraph 1 of the order was intended to cover that issue of if there's a federal or state regulation or law that would otherwise prevent or prohibit the wearing of a face covering, it is addressed with paragraph 1 of the order to take that into account. And that's what we did with respect to the order itself.
Thank you. So my follow-up question, and then I'll leave it there. Would the results of the survey from our community that Ms. Lopez is working on be of value in making the decision on whether to support this effort, given it's a response to an emergency situation where we are seeing an increase in exposure that is possibly directly related to individuals not wearing face coverings? That's a sort of question to the group. And if that is the case, that would matter, or give you enough assurances that the public is generally in support of wearing a face covering, or, for example, one of the questions is, do you plan on going to a business that doesn't require face coverings and supporting that business? And if they don't have face coverings, would you not go there? Would that information assist you in moving forward and providing this protection for individuals that are wanting or needing to wear face coverings in a public or private setting? So let's just put that out there before we vote on it, and it looks like it's going to get shot down.
Mayor Lott, you recognize. Mayor Lott.
Sorry, I put my head down.
Okay. I see no further hands. Mayor Castro, you recognize.
Yeah, I just want to say before the vote, this is a very simple issue, and it's trying to be framed as something more difficult than it is. And Mayor Lott, the evidence, you said there is no data, there is no evidence, there is no public hearing. The public opinion that was just discussed indicated that the public is in favor of face masks. The data certainly shows that it's effective in reducing the transmission of this disease. So all of that information, that data, that research, that evidence is all readily available. And what Commissioner Overman is trying to pass here is something that is very simple and very, very temporary in that it will protect the public and allow the public to wear facial coverings so that they don't transmit or contract this deadly virus. And I think it's very simple, and it's being blown out of proportion in my personal opinion. And I thank you, Commissioner Overman, for bringing it forward. That's all, Chair. Thank you.
Before we vote, I'm going to ask Ms. Beck to read the draft one more time.
Commissioner, you wanted me to read the language in the order?
Yes, the draft order.
Okay. I'm skipping all the whereas clauses, but the substance of the order is as follows. All persons in Hillsborough County are permitted to wear protective face coverings in public and private settings unless the wearing of a protective face covering is specifically prohibited by state or federal regulation or law. Any person interfering or attempting to interfere with another person's desire to wear a protective face covering in public and/or private settings shall be in violation of this executive order. This executive order shall take effect immediately upon adoption and shall remain in effect for the duration of the COVID-19 state of emergency in Hillsborough County unless extended or rescinded.
Okay, seeing no further discussion, please call the roll on the motion by Commissioner Overman, second by Mayor Castor.
Miller?
Yes.
Overman?
Yes.
Merman?
No.
Cronister?
No.
Castor?
Yes.
Ross?
No.
Lott?
No.
Snively?
No.
Motion failed 3-5. Merman, Cronister, Ross, Lott, and Snively voted no.
Okay. Ms. Beck, extension of the emergency order.
Yes, Commissioner. The EPG has been provided with another executive order draft that would extend the local state of emergency, and it would be appropriate now to consider that order.
Is there a motion to extend the order?
Move approval, Commissioner Merman.
Motion by Commissioner Merman.
Second by Member Snively.
Second by Ms. Snively. I see no discussion on extending the order. Please call the roll.
Miller?
Yes.
Overman?
Yes.
Merman?
Yes.
Cronister?
Yes.
Castor?
Yes.
Ross?
Yes.
Lott?
Yes.
Snively?
Yes.
Motion carried 8-0.
Thank you, Ms. Beck. We're now on open discussion. Is there any top topics that any member of the EPG would like to discuss today? Any topics? Any discussion? Seeing no hands, that's all the business we have today. We'll meet again next Thursday. So everyone be careful, be safe, be wise, and we'll see you. Have a good weekend, and we'll see you next Thursday. With that being said, we adjourn.